In this video, I'm going to be briefly talking about menopause. What is it? How do you get the right diagnosis? What are symptoms that accompany menopause? And what can be done about these troublesome symptoms? My name is Dr. Omar Akhter. I'm an MD and a board certified internist with a private practice here in Austin, Texas that focuses on a holistic approach to chronic disease with a specific focus on hormone optimization. Now, when we talk about menopause, what we're really talking about is the decline in the production of estrogen and progesterone and the hormones that come from the female ovary that essentially will happen somewhere around the age of 48 to 51, roughly. Now, that can be earlier for some women, later for other women, but it's usually on average going to be at the age of 50 or 51, where a woman ceases to have her menstrual cycle and the production of these female hormones stops. Now, the question is, how do we get to the diagnosis of menopause? The main diagnosis is done by the cessation of cycles for 12 months, a total of 12 months, which means that if you have had your last cycle on a certain month or on a certain day, then a whole 12-month period goes by, and if that's the case, then you know you're in menopause. Even if 6 or 7 months go by and you have a cycle again, then you have to start that count again. So a total of a 12-month duration without cycles means you're in menopause. In some cases, you may not have the ability to have cycles. So, for instance, women that have had a hysterectomy or a uterine ablation or something in which they don't have cycles, but their ovaries were still left in. The question is then, how do they know that they are naturally in menopause? And then you can do blood levels, especially of estradiol and FSH. So estradiol being the primary estrogen in our body and in the body of women is going to be extremely low at the time of menopause because its production will go down to zero basically. So you'll see estradiol levels in the blood being less than 5 or so. But more importantly, you'll see the FSH rising. And the FSH stands for follicle stimulating hormone, which is the hormone released from the brain, which controls the ovarian production of these hormones. And the FSH level starts to rise gradually until it hits a level of about 50 or so. And beyond which point you know that you're in menopause. So if you don't have the ability to see that 12-month period without the cycle, then you can use the FSH levels at times to be able to tell if you're in menopause. So the FSH levels, generally speaking, 50 and above, will lead you to the diagnosis of menopause. Now, what's really important is to understand that the symptoms that can arise, and I'm very careful not to classify menopause as a disease state because we realize and recognize that it is a part of natural aging in women. It's another phase of their life where the period from menarche, which is starting of cycles, to menopause, which is the end of cycle, it's just another period. So you're entering or graduating into a different phase in your life. But it's important to understand that it can be accompanied by various signs and symptoms, such as women can have hot flashes, night sweats, low libido. They can have vaginal dryness. These are amongst some of the symptoms that occur in menopause. Also, insomnia or poor sleep can occur. Women's bone health deteriorates because the bone mineral density that was improved with estradiol, that goes down. So the risk of osteoporosis goes up, risk of cardiovascular disease goes up, the risk of Alzheimer's goes up. So all of this happens as women transition into menopause. So it's important to not classify this as a disease state, but also understand that there are adverse health issues in terms of symptoms or conditions that can arise from the loss of these hormones. And when that happens, I think it's very important to give women the correct information and the options for effective hormone replacement therapy. And I mentioned this because unfortunately so many women get the wrong information, and they also get this sense of hormone replacement therapy being very dangerous or potentially have the risks of various cancers and things like that, which unfortunately are not accurate. Um, it's just not accurate information that women are given. So women need to be given important information and also given good treatment options on how they can effectively replace these hormones bioidentically, which means with the same hormones that are in their body and not with synthetic hormones that are often in the form of pharmaceutical drugs. And so, with that, we can give them hopefully effective therapy to overcome these symptoms and improve these symptoms, and ultimately improve things like bone mineral density, cardiovascular health, brain health, and prevent a lot of the diseases that occur as a result. So, that was just a little information on menopause. If you enjoyed this video, please give it a like and subscribe to the channel so that we can keep putting out beneficial and informative content to everyone. Thank you very much.